Welcome to Leveraging the Laboratory, a Mayo Clinic Laboratories podcast for administrators, outreach managers, and laboratory professionals to learn how best to leverage and optimize the laboratory for patients, clients, and staff. I'm your host, Jane Hermansen, Outreach Manager at Mayo Clinic Laboratories. And joining me today, old and dear friend, Mark Kjer, who is the manager of our technologist support group within Mayo Clinic Laboratories. Our topic today is related to how the outreach program is viewed from the inside lab at the operations and the technical levels. And Mark brings a really unique outreach perspective as to how to work with customer needs, laboratory needs, operational needs, and managing responses across all of those areas. So when you think about it, he's the nexus that really keeps all of the things related to Mayo Clinic Laboratories business together. And I probably didn't say that as well as I could have, Mark. So maybe you can tell me a little about yourself and what your role is at Mayo Clinic.
Yeah, thanks, Jane. It's great to be here. So I've worked in laboratory for about 30 years. I've worked in a critical access hospital. I've managed a physician office laboratory of about 30 providers. And I've worked as a technologist in Mayo Clinic's automated core laboratory. For about the last 20 years, I've been a part of Mayo Clinic Laboratories, which is the outreach program of Mayo Clinic's Department of Lab Medicine and Pathology. And I supervise the technologist support team, which is a group that partners with you, Jane, and your team to support clients' outreach programs by traveling on site for a view of how our client laboratories perform their ancillary operational processes. So that experience is kind of the basis of what I'm going to be talking about today.
Perfect. Well, and in this podcast, we talk a lot about the pre and post analytic aspects of the lab outreach program. And the perspective of the testing lab is just assumed. And I know in your role, because I used to do that job, you work a lot with the laboratories. And although it's assumed because it's already there, there's a lot of stuff that needs to be done really to make sure the labs are on board and supporting the outreach program accordingly. So we know there can be a new set of challenges that are associated with the outreach program from the lab's internal view. So from your perspective, based on Mayo Clinic and just also the hospital labs that you've worked with, what do you see as those main challenges related to the outreach program from the lab's perspective?
Well, from the perspective of a hospital laboratory in a community doing outreach, the biggest challenge is smoothly integrating those outreach samples into their existing processes when they need fundamentally different steps to occur, such as registration or needing a process to clarify questions or issues about an order. It's simply fundamentally different work where each tube can be like a new patient walking in the door. So hospital laboratory assistants can find themselves dealing with insurance information. They can be trying to determine the appropriateness of diagnosis codes that are provided on manual recs. And a lot of this ancillary work is sometimes just folded into the existing internal work, which stresses the system for both the internal and external patients.
And they're truly not prepared for it for the most part. And it requires just a whole new set of training. And staff are frequently being set up to perform a task that they're not ready for. So, from your perspective, what elements do you think are needed to set those staff up for success? What kind of support do they need in order to do their jobs well?
There's really three aspects of pre-analytic work that I commonly see neglected, which has always struck me as a little bit odd because they're things that laboratories otherwise are really naturally good at. The first is having up-to-date and dynamic and used standard operating procedures for your pre-analytic staff and how to do their job. If I'm visiting a client site, I'll often see a lab assistant processing that outreach work one way. If I look at a second employee, they may be doing it very differently. It seems like people just kind of do it their own way instead of determining what the best practices are and following those best practices throughout the team. The second topic I often see neglected is having outreach operations metrics. Laboratories can readily determine how many CBCs they may run in any given month or what their turnaround times are, but metrics often aren't kept in pre-analytic outreach processes. So they don't always know how many incoming defects they get. They don't always know how many phone calls they get or where those phone calls come from or what the resolution to those calls are. The third step is having clearly defined processes and expectations of what the scope of people's jobs really are, and then correctly matching qualifications with those responsibilities. So you could ask yourself, are your lab assistants also your customer service agents, your registration team, your stock clerk, and your phlebotomists? Sometimes this happens because it's hard to make the steps to grow your team and specialize and have those specific roles to do those things well. And that's where having the metrics really can help our hospital clients, grow the staffs that they need to do outreach well.
Well, and I really appreciate the just kind of making sure that you've got the right processes in place and you're setting the people up for success. A quote that I heard a long time ago was, if you can't measure it, you can't manage it. So clearly, metrics are such an important part, and it's not something that a lab thinks about with metrics related to the outreach program. They might do a good job of quality control, coefficients of variation, all of that stuff on the lab side, but when it comes to the business and operations, their metrics may be quite a bit weaker. So let me shift gears just a little bit to think about, from the lab scientist perspective, the bench level. What would you, if you, in your dream world, what would you like lab scientists to understand about the needs of the outreach customers so that they can do a better job of serving outreach clients?
I would just start with a simple concept of just getting on board with being an outreach performing reference laboratory. Invest in that concept and be supportive of it. See those samples not just as extra work to do, but as a vital part of strengthening the financial health of your organization and your department. I would be open to recognizing that increases in outreach volume can change test set of times or lead to small adjustment in shifts, and realize that you can also run tests and provide good customer service on the phone. That's not an either or situation, but you can do both. When the phone rings, yes, it can be your job to answer it and realize there's a customer on the other end of the line who can choose where to send their samples. So based on the experience that they have with your team, with your technologists, if it's a complex question, that can affect the health of your outreach program.
Oh, absolutely. And all it takes is one person. And when I was in the lab, we had one person that when the phone rang, she wanted to run to the phone and pick it up every time. And it was a deadly weapon when it was in her hands. So we would all kind of have a race to say, no, 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 it's okay. You can sit down. I've got this one, because we did not want her talking to a customer because she was rather toxic. So Mark, I think you hit on something related to the culture, right? To say we're going to shift, we're not an inpatient lab. These outpatient, these external volumes are important and necessary to our business. How do you get that buy-in for people to, they're going to have to work harder, their shift might change? How, as a leader, would you recommend our audience says, okay, you know what, we have to make some changes here. How do I communicate this?
I think just communicate the goal of what you're trying to do. I think if you can if your staff understands the goal, they can become invested in that goal and they can help you meet that goal. I think sometimes there can be a disconnect where maybe a leadership team is invested in doing outreach, but they may not communicate that vision to their staff. So the staff don't know what where they're going. So they may not be fully invested. Then you may not see that discretionary effort that you want to get your work done.
Right. Right. Well, and they're going to have to work a little bit harder. They're going to have to work differently. But when they realize that this is job security, and I've even seen places that we've gone into where when they've lost a customer, there's a palpable change in volumes in the lab, and they get worried because, oh my gosh, our volumes are down. Are we still going to have jobs? So I've seen this actually have a nice positive impact on how the lab is engaged. So let's continue to think about it from the scientist level. They're working harder, might be working a
Mhm.
new shift. What functions do you see and have you seen through your travels? What are technologists doing in support of outreach that maybe they shouldn't be doing? Maybe there should be someone else in the department that should be supporting some functions.
I think going back to the topic we discussed a few minutes ago about clearly defined job roles and understanding that nationally there's a shortage of technologists and clinical lab scientists. You don't need to have them doing pre-analytic tasks such as centrifuging samples, uh, delivering them throughout the departments, faxing reports, or other pre-analytic things that could be done by a lab assistant. Um, that's where setting expectations can help so they can, do the appropriate things of running their samples, maybe running a batch that's twice as big as it used to be before you started doing outreach, serving as a secondary level of customer service and answering complex questions and supporting the lab assistants when those lab assistants have questions about specimen acceptability.
So truly using their scientific minds to add value to the scientific and technical clinical aspects of the laboratory and not just the operational piece. And what I think would really help the frontline staff be more effective is actually making sure that when those technologists are seeing things that would help their work be easier if the frontline people had it to provide content, information, guidelines, things like that. And I remember visiting a place where a young lady was looking at a specimen and she'd say, "Oh, I have to reject this one." And I'd say, "Well, how do you know that?" She says, "Oh, it's all right here in my head." And I said, "So what happens when you're not here?" And she'd say, "Oh, well, yeah, I don't know. I don't know how anybody else handles it because it's all right here in my head." So let's make sure we take whatever that information is in their heads, put it into something formal to support them from doing a good to support them in doing a good job. So if we think about it from the customer perspective and how they have specific needs for the laboratory, what role do you think client feedback plays in gaining support from the laboratory? Any thoughts on that?
It can be enlightening to realize that other people can see things differently than ourselves, particularly when you're fully embedded in a workplace like a busy laboratory. Take the topic of turnaround time, where you may have some tests that are a real priority based on your customer base, and you may have some tests that are less of a priority. They could be more routine. So understanding what tests need to be turned around quickly, say some hormone testing for a fertility clinic, and what things don't need to be set up right away. Maybe a microbiology culture that's going to take 2 or 3 days to report. Prioritizing those things and acting appropriately can improve your overall operational quality in the eyes of your customer.
Well, and I think what you're hitting is keeping that patient first view and making sure that the laboratory understands the importance of that external specimen being a patient as well as the internal specimens that they're handling every day. So I want to shift gears just a little bit, Mark, and let's talk about another key player. So we've talked about the pre-analytic folks, talked about the analytic folks. How about the pathologist or the lab medical director? How do you see the pathologist's role in supporting the laboratory to be an externally focused group, and what is their value in doing so?
Well, I think just the term of laboratory director denotes a natural leadership role. So I would encourage pathologists, medical directors to be engaged and supportive of the outreach program and be an approachable resource for staff who are trying to make a correct decision with a result or how a sample's labeled, etc. I would want your medical directors to serve as an advocate for outreach resources at the executive level with hospital leadership. And just in general, literally keep an open door while you're looking at slides, and being a positive, engaged leader within the laboratory. When it comes to understanding their value in interacting with outreach customers, it's a really powerful role because your pathologist can be a powerful service differentiator for your outreach customers because they are a local, live, medical doctor that can be a resource to advise on which tests to order, which is very important these days when you have consumers who are shopping around for lab tests, looking up tests on the internet, deciding they want them. So outreach clients have that sort of pressure and can use some guidance from a medical director about the appropriateness of those tests, as well as the complexity of genetic tests and which tests are appropriate to order and which aren't, because there's many different options and they're all very expensive. So ordering the correct one becomes very important.
I really like what you said about the consumers shopping because they don't know, right? They have no idea. And I was recently in an organization that actually has a conference room near their entry where a patient can come in and actually have a meeting with a pathologist. Now, there's no CPT code attached to that. They're not getting paid for that patient conversation, but at least they're helping guide the right testing that's going to be ordered for that patient. So I think that's cool. The other piece is the advocacy piece and being the advocate as the medical director, the leader to advocate for those resources at the executive level and bring the physician view. I always heard it said that the pathologist is the doctor's doctor. If the doctor can't figure it out, who are they going to talk to? They'll talk to the pathologist. And my last, kind of thought to expand on what you said, Mark, is that the standard view of pathology has always been looking at slides, looking through the microscope. That's how the outside views what pathologists do. But as we've become much more broad in how we're taking testing and we're merging clinical results with anatomic results, and we're actually creating a whole picture for that pathologist to be broader and more engaged, is only going to help the laboratory's deliverable be a stronger product, in my opinion. Mark, we're nearing the end of our time. I know you have seen a ton of stuff out there. You have probably visited hundreds of hospital laboratories through your 20 years in Mayo Clinic Laboratories in your role in the technologist support and in your leadership role. Have you seen anything that you would consider a really interesting best practice that you think our audience would be interested in as far as how labs are handling outreach today?
I would say, building on the word interesting and what you said a few minutes ago about a pathologist having a consultative room outside the waiting room, is I'd encourage people to evaluate their perspectives on their patient experience literally in their waiting rooms. I went to one laboratory that had this wonderful exhibit of antique laboratory stuff, like brass microscopes and brass balances and beautiful wood things, celebrating, kind of the roots of the laboratory. And it was really cool. And it was also very engaging for the patients. And if you think about the topic of we've talked about of, looking out from the laboratory, sometimes waiting rooms can be sort of an afterthought. They can be a little institutional. So what can we do to make those areas more pleasant for our patients? And it doesn't have to be capital expenses, but just a simple fresh coat of non-institutional paint, an updated TV set, calming art, pictures, etc., just to improve that waiting room for those patients, because in their eyes, that waiting room is the laboratory. So what are we doing for those patients?
Well, and it's maybe they're not waiting for something that's fun. They're waiting for an
Right.
unpleasant experience.
Yep.
So you want to salve it as much as you can. Do you have any anecdotes or funny stories of things that you've seen? I remember one that you shared with me. So if you share it with here, I won't have to repeat it. But is there anything that you've seen that you just kind of go, oh wow, that's one for the record books?
I think one anecdote that isn't necessarily funny, but it was sort of surprising, is I was visiting a laboratory that was having a challenge with missing samples, and they couldn't quite figure out what the issue was with their missing samples. So I'm looking at their processing area, and everyone, as happens in many places, samples are being processed on a countertop. And right next to the countertop was this large biohazard bag that samples could just roll off into. And I'm like, have you ever thought about moving that or putting a cover on it? That could affect your missing sample rate. It was sort of just a general aha moment, because, I think we solved where their missing samples were ending up.
Absolutely. So place specimens here, right in the trash. One odd thing that I saw, and it was really related to culture, was that an organization had turned their outreach program on a certain day. And here's day one for the program. Specimens were coming from the outside, and they hadn't communicated to the people at the bench level. And the bench level folks would pick it up. They didn't see the right identifiers on the tubes, threw them right in the trash. So come midday, they hadn't delivered any results. Here's the medical director digging through the trash to pull the specimens out and say, no, 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 you have to run this. This came from an outside source. It's a little bit different today. So clearly, by having the lab staff on board is so, so important. And truly, Mark, I want to thank you, because I think what you did today is brought just a little different view from the laboratory perspective, and how all of the processes can impact the scientists as well as the internal departments. So thank you so much, Mark, for taking the time today to share your views on how the lab outreach program impacts the testing labs and ways to optimize that. Thanks so much. And to our audience, I want to thank you for listening to our podcast today. And I want to remind you that registration is now open for our 35th Outreach Conference. Leveraging the Laboratory Sees Tomorrow will be held in Rochester, Minnesota on September 17th and 18th, 2024. So for more information, please visit our Mayo Clinic Labs.com website, click on Education and Conferences, and I hope to see you there. And thank you for listening to Leveraging the Laboratory, a podcast from Mayo Clinic Laboratories. If you've enjoyed this podcast, please subscribe. And until next time, we encourage you to continue to promote your community-based hospital laboratory. The needs of the patient come first.